Benign prostatic hyperplasia, also known as BPH, is an enlargement of the prostate gland. It's a common condition as men get older. It affects 50% of men over the age of 50 years. An enlarged prostate gland can cause uncomfortable urinary symptoms, such as blocking the flow of urine out of the bladder. It can also cause bladder, urinary tract, or kidney problems.
Prostate laser surgery is used to relieve moderate to severe urinary symptoms caused by an enlarged prostate. The type of laser surgery your doctor recommends will depend on several factors, including the size of your prostate and your overall health. Joining us on the phone from Jacksonville, Florida to discuss BPH is Mayo Clinic urologist Dr. Chandler Dora. Welcome to the program, Dr. Dora.
Thank you for having me.
Explain BPH. What is it exactly?
BPH is a expansion of the center of the prostate, and in its more advanced forms, it causes constriction of the urethra, which results in difficulty urinating and retention of urine.
And what causes it?
We don't really know. It's likely a combination of genetics, and it definitely has a strong association with age.
So in primary care, we see and manage a lot of men who have urinary symptoms. And you know, as you think about the patients that you see as a subspecialist, do you usually see our most severe cases, or what's the right time to refer, or what's really good advice for men to see their primary care doc? When should they see their primary care doc if they're having symptoms? What would you say?
Well, that's an excellent question, Dr. Ebert, and I think that primary care doctors can do an excellent job managing most cases of lower urinary tract symptoms. And there's certainly nothing wrong, and we don't mind, and we actually appreciate when the primary care doctor is proactive about trying men on medications when it's appropriate, and then if it becomes refractory where the medications aren't working, or if the patient experiences a enlarged prostate-related complication, like having to have a catheter inserted, then they refer them on to the urologist. And that allows us to spend our time with the most severe cases, who are the people who really warrant spending a lot of time with.
Yeah, so when I see these patients, decreased strength of stream, hesitancy, double voiding, dribbling, of all those symptoms, the one that seems to really get patients the most is this nocturia, the waking up 6 or 7 times a night. That really seems to get them. Is that always BPH? Is that always what's causing that?
That's not always BPH. It can be, but when we as urologists see these people, we like to put them into a category of either what we call nocturnal polyuria, meaning their bodies are producing a lot of urine at night, or a nighttime reduced bladder capacity, meaning they're producing a normal amount of urine, but their bladder is not storing that urine appropriately. And so usually when we see those patients, we'll have them fill out a bladder diary that tells us how many times they urinate at night and then how much they urinate each time. And we'll determine if they're producing more than about 25% of their overall urine output during nighttime hours. And if they are, then they may benefit from a certain type of medication versus the people who have a reduced bladder capacity, who would benefit from a different type of medication.
Does BPH mean that you're more at risk for prostate cancer?
No. So they are two completely separate disease processes.
All right. What are the pros and cons of the conventional treatments before you get to surgery? What are let's talk first about watchful waiting. I mean, if 50% of men over the age of 50 are going to end up with BPH, is part of the first thing you do just change your habits and see what happens?
Yes. So lifestyle modification is always a good first-line therapy. So things like decreasing your fluid intake 2 hours before bedtime, that's always a good first step. And then the next step would be medications. But you were mentioning complications of BPH, and when we look at these very large studies of men who have been followed for many years, such as the Olmsted County study or the Baltimore longitudinal study, we see that the risk of a man going into complete retention where he can't urinate or having the urine back up into the kidneys is a relatively rare event. It happens in about 2% of men with enlarged prostate. So you can manage these people with medications or observation without fear that they're going to ruin their kidneys or something bad is going to happen. That is a relatively rare event. It does happen, but it's fairly rare, and it's difficult to predict exactly who that's going to happen in.
So if that doesn't work, then surgery is your next option?
Right. If we try lifestyle modification and then we put them on medications and they're still having a lot of problems, that's typically when we start discussing procedures or surgical intervention.
So when we do that, and when we refer, and I just referred a patient to urology the other day, we maxed out our medication therapy, and then I saw a list of different options that were offered to the man. Could you just go through a couple of those surgical options and who gets what when?
Absolutely, and I view the procedures for enlarged prostate as almost like a hierarchy, where some achieve improvement in the opening and improvement in flow, and some achieve greater effectiveness than others with increasing the opening in the prostate. And if you have a man with relatively mild symptoms who maybe doesn't want to be on medications but is getting along okay with the medications, then we do have some office-based procedures, such as the something called the Resume, which is a procedure where we inject steam into the prostate in the office, or something like Urolift, where we use a implant which draws the lobes of the prostate apart like a curtain pull back. Those things can be done in the office, and they usually achieve good symptom relief for men who have prostates under 80 grams and mild to moderate symptoms.
And the other surgical options then, if that doesn't work, would be what?
The more invasive surgical options for men with more severe symptoms are typically done in the operating room under general anesthesia. And that would be your traditional TURP, which is where we use electrical current to shave out the prostate tissue that's blocking, or something like what I commonly do, which is called laser enucleation of the prostate, which is where I use a laser to remove the center of the prostate, almost like you would go up inside of an orange and separate the fruit from the rind all the way around, and then remove the fruit and leave the rind there. I just want to add that men shouldn't be fearful of seeing a urologist. We typically have to overcome a lot of anxiety in people, and just to let them know that our interests are aligned with their interests, and we want them to have good outcome, urinate well, preserve good sexual functioning, and be happy.
Yeah, suffering through BPH is probably not the way to go. Go and see your urologist.
And I would say good partnership with primary care. We have excellent partnership in the urology department, and they're fantastic. So that partnership is critical in making patients feel comfortable and safe and well cared for.
We've been discussing surgical treatment options for an enlarged prostate with Dr. Chandler Dora, a urologist at Mayo Clinic in Jacksonville, Florida. Thanks for joining us, Dr. Dora.
Thank you for having me.